Hello, YouTube and fellow Achilles Rupturees. My name's Phil, and if you found me, you're probably looking for answers on Achilles tendon ruptures, possibly surgical versus non-surgical. Looking on YouTube is probably not the best place to find these answers, but you found me. I did a bunch of research on it, and I just want to share some of what I found, and I also want to share my recovery process. So it's been about 3 weeks since I initially injured my Achilles. I was playing badminton, fell backwards, felt a pop, heard a pop, knew exactly what happened. I used to play badminton at a fairly high level, stopped about 4 years ago, pretty much cold turkey, didn't really do any explosive sports after that, just rock climb and weightlifting. It just happened. I felt a little bit of tension inside my calf, about a inch diameter on the inside of the back of my calf, which was really weird. And I was kind of like, maybe I'm gonna get like a bit of a cramp. Haven't played in a while. I'm not really sure. It was bizarre, but and honestly, in my head, I was like, this could be my Achilles. And you know what? 2 minutes later, boom, it happened. So listen to that voice in the back of your head when something in your body is a little bit weird. If anything, I can take away from this, that's what I've learned. Anyway, that night, after I tore it, I went to the hospital and I was put into an ultrasound clinic, or I was taken to an ultrasound guy. He started looking, started rubbing that gel, looking up and down the Achilles, used my other Achilles, couldn't find anything. So he called in his boss, who was a doctor of ultrasound, I'm not sure what they're called, and his boss was going through it, and he said, yeah, you have a full rupture near your upper Achilles where your Achilles and your calf intersect. So he said I'd be in surgery that night, and so I was starting to get a little bit prepared for that. Nobody, I think, really wants to go through surgery. And I went back to emergency, sitting on those hospital gurneys, whatever they're called, and the GP comes to me and she starts saying, you know what, we're not going to put you in surgery, we're going to put you in a cast. And I'm like, okay, that doesn't sound right to me, but I don't have a ton of information on this right now. So I was talking to her, I wanted to get as much information as I could from her, because I need to be convinced that the treatment I'm getting is the treatment that I need. So she starts to, she starts to actually seem a little bit unsure. So she brought over another guy who was also a doctor, and he kind of outlines surgical versus non-surgical treatment. And he's saying that the latest literature is really showing non-surgical is the way to go. So, two opinions, one hospital. I go home and after I'm put into a cast, so put into a cast with flexion. So your toe is pointing towards the ground, they cast it. And what that does, so if this is a normal person's Achilles, and this is mine, when you point your toes down, it brings your Achilles ruptured ends together. And so the idea is that if they're touching, they'll repair themselves. So that was about 3 weeks ago. Went home that night, started doing a ton of research on Achilles tendon ruptures, non-surgical approaches. And what I found was that non-surgical generally has longer recovery time by, up to a month. It has increased re-rupture rates. And it may have a decreased overall function at the end of the day. So after reading those, I started to get concerned. I was like, maybe I need surgery. And if surgery is going to get me back to 100%, whereas non-surgical is not, I'm getting surgery. There's no doubt in my mind that that's the way I would go. So I wanted to get another opinion. So I called my physiotherapist, and she was like, okay, go to the Peter Lougheed. I live in Calgary, Alberta, Canada, free healthcare. So I went to a different hospital the next day, waited in emergency, was basically told that I wasn't able to just shop around for which hospital I wanted to go to, even though I paid tons of taxes. Talked to the lady. She put me in my healthcare number, pulled up my file, and actually she started to get a little bit concerned. She was like, well, it looks like they wanted to get a hold of you for something. And so I'm like, well, maybe they screwed up with the ultrasound. Maybe the ultrasound guy was right. So they take me, they put me into a room, they take off my cast. Another GP comes to talk to me, and he's like, you know what? I understand, like, you're pretty concerned about the injury. It's a big injury. And he's telling me that he'll go get the orthopedic surgeon that they have on call, but he still thinks they will go with the non-surgical method. So they take my cast off. The orthopedic surgeon comes down, start talking to her, and she's saying that, yeah, we're going to go with the non-surgical method for you. So now this is 4 doctors, 3 GPs, I guess, 1 orthopedic surgeon who are all recommending non-surgical. So I'm asking this orthopedic surgeon who's in residency, I'm asking her things about tendon lengthening, how I'm concerned that my tendon will heal in a lengthened state. I've been reading that lengthened tendons lead to reduced recovery, reduced explosiveness, and that it's likened to running on a dead tire. And she says, yeah, that's a concern for both surgical and non-surgical approaches. She said that surgical approaches are generally used for athletes because it's kind of the standard approach, and it's more, there's a little bit more documentation on it. But then she also said, oh, sorry, it's dog. And, oh, where'd the other dog go? Charles. There he is. Anyway, sorry guys. I'm sure you don't give a fuck about these dogs. So yeah, she's telling me that for athletes, generally they do that. And she's saying that the difference between surgical and non-surgical is the strength of your calf muscle and everything is the same based on the 2 surgery or based on the 2 treatment options. And the circumference of your calf is the same based on the 2 treatment options. But what she said is that explosive strength, so when you're coming down, you hit the ground and move away really quickly, you know, like that really plyometric preloading jump type thing. She says comes back 90% in non-surgical, 95% in surgical. But she said that number was statistically skewed because generally high-level athletes are going to rehab more seriously and more completely than a normal person who is more likely to get the non-surgical approach. So after hearing all that and her telling me that infections were a concern for surgical route and that infections in the area were a complete nightmare, she actually went on to explain that if you get an infection in your Achilles tendon area that doesn't respond to antibiotics, what they have to do is they have to cut part of your calf muscle off, pull it over your Achilles tendon and sew it into place to increase the blood supply. And she was basically saying you're never going to walk properly after that again. So we want to do anything we can to minimize that chance. So basically what it comes down to, and this is through, you know, my own research as well for surgical versus non-surgical, is it comes down to the rehabilitation process, and it comes down to having to take it a little bit slower for non-surgical, but having no risk of infection. So, you know, if you have to wait an extra 1 to 1.5 months to be back to 100% with 0 risk of infection, a life-changing infection, that's probably the way to go. And she also said that, you know, high-level athletes can recover from non-surgical treatments as well. It's all about the rehabilitation process after you get out of the cast. So went back home, did a bunch more research on it. And yeah, it seems like that is the newer way of looking at things. That is the newer academic papers are more likely to suggest non-surgical methods. And I just wanted to clear up another misconception about Achilles tendon ruptures. So a lot of people, if this is your Achilles tendon, a lot of people are like, if you rupture your Achilles, it's like this. You know, it's like samurai sword cut in half. But really, it's more like, oh, geez, first time doing this. It's more like when you rupture your Achilles, it's more like, you know, it's like that. And so if you put your foot in flexion and immobilize it, first thing it does is this. And then over time, the idea is it reheals itself with scar tissue. So that was something I didn't really understand. I highly recommend you checking out Brady Brown. He's a CFL player who also made a YouTube blog on his recovery, and it seems like he returns to a pretty high level of function through the non-surgical method. If you guys have any questions for me, please just write them in the comment section. I'll do my best to respond to them in a fairly timely fashion. You know, I'll check it maybe once a week. I'm going to keep making these log posts. If there's anything I missed in this first post, I'll try to address it in the next one I do. And yeah, it's not the end of the world. Getting your Achilles ruptured is a huge pain. I can't drive. Getting to work, I'm relying on my girlfriend, who's being an absolute saint. I'm incredibly lucky. Yeah, crutches are an upper body workout, but you can slip on crutches. You can't really use your hands while you're on crutches, and it's just a huge pain. So anyway, guys, I wish you the very best. I'll be making these YouTube videos, maybe once a week, trying to show how the progress I've been making. This video blog is more about my initial research than a recovery. But yeah, I hope this video finds you well, and I hope this gives you a little bit of information on surgical versus non-surgical. And I really do wish you guys the best, because this injury sucks.